If I had a melanoma, I would not do anything but surgery, and I would do it fast and I would do it completely. And I would not worry about the scar because you just want to get that off your body. The great news about melanoma, and this is not meant to liberate people to get more sun damage, but it's meant to give solace, I guess, to maybe some people listening who do have melanoma, is that there are wonderful new immunomodulator therapies that can be taken by infusion that can be very helpful for melanoma. If you had surgery, but it had already spread to the lymph nodes, just like breast cancer has new wonderful treatments, melanoma has had a renaissance in treatments. And so the mortality rate is a lot lower now.
All right. Well, it's a real pleasure to have Dr. Ellen Marmur to the show today. Welcome.
Thank you. So happy to be with you.
So, okay, I was just explaining to you how we got connected, and we want this show to be really focused on skin and skin cancer. And you're a dermatologist, and as we read in your introduction, yeah, you've had your own challenges with skin cancer. And the woman who connected me to you, who was a huge fan of you, I think she saw you on stage or in some conference, and then she follows you and she says, yeah, you've got to follow Dr. Allen and you've got to have her on the show. My mom died of of skin cancer. And this is a really important topic and I want you to talk about it. And I'm in the biohacking community. So we're all about, let's get in the sun. There's some people who say, sunscreen is toxic. Don't wear it. There are benefits to the sun and light, and I think there's probably somewhere in between. But we would like to talk a little bit about what kind of risks versus benefits are we getting when we go into the sun. But when we're talking about skin cancer that a woman in midlife needs to be aware of, what should she really be concerned about?
Well, I think as you said, biohacking is sort of accepting moderation is key. Like lifestyle matters a lot. And if you love being active and if you love exercise and that means taking you outside, that's healthy. So follow your gut feeling. But if you're sitting outside all the time, like in that Something About Mary character who's just sort of like shellacked with tan, that's not good for your skin. So I started something called Skin Cancer Take a Hike, which means every year I lead a trip of hikers at altitude somewhere outside for an entire week. And we use smart sun protective measures to show that you can live your life to the fullest, be healthy, be outside, embrace all that healthfulness, and also protect yourself from skin cancer.
We'll go into that. I have more specific questions I want to ask you. So I'm glad, yeah, we can go outside. Of course, it should be good. But we're going to talk about how to balance that a little bit later.
Yeah.
But I want to first focus on skin because there's different types of skin cancer, right? And there's different
Yes.
grades. And so when we're in this midlife transition, because we want to focus on the woman going through menopause, her hormones are changing and her skin is changing. So what kind of concerns should she have other than wrinkles and spots and all that?
Right. I mean, everyone's so different. So dermatology is like a very complex field, but you and I have fair skin. We probably had a lot of sun exposure throughout our early life, right? So now that we're in our midlife and we know that estrogen helps support collagen, which is the main protein of the skin that helps protect your skin in many ways in terms of like rejuvenation. If you think about your body is repairing itself all the time from all the different damages, pollution, exposures, inside, outside. Your body is constantly regenerating, which is what biohacking is kind of all about. But when we go through perimenopause and menopause, our estrogen is less supportive of some of those mechanisms. In the skin, that mechanism is the collagen, and the fibroblasts are now a little bit less able to be strong. So anything you do that's harsh on your skin is going to be even harder to recover from. So sun exposure in your midlife is harder to recover from. Your immune system, your inflammatory system, everything's a little bit off. And so those repair mechanisms aren't as fine-tuned as they were. Plus, you have memory from all the sun exposure you had going up into that point. So I'm not saying that you don't need sun exposure, but moderate sun exposure is the way to go. Using sun protection is not 100% foolproof. So you're still getting that UV ray that you need to activate the healthful vitamin D activation in your skin. So moderate sun exposure, all throughout the day is okay, but sun tans are a form of injury to the skin. If you think about it like smoking cigarettes, it's considered similar in terms of its risk, in terms of cancer. So sun tans are not healthy. When you see a tan line, your tan skin is crying because it's been injured, and that melanin production for the tan is actually literally pigment that's been produced to protect the DNA. It's like a little hat protecting the DNA. So tan is a visible way of telling you alarm bells are going off in your DNA, and it's protecting your DNA from mutations from that heat of the UV ray hitting your DNA in your skin cells. So tan might look beautiful and you might think it's making you look glorious, but it's actually a cry for help from your skin. Sunburns are even worse. So sunburns are connected a lot more to melanoma and to skin cancers. Sunburns are when you turn red. And that's where sun protection actually helps the most. Most of the ingredients from sun protection are really helping against sunburns. And so some people say, I still got tan even though I put sunscreen on. And that's true. So that's where you have to actually wear a hat or sit under an umbrella, or you wear this new cute like UV protective clothing. So we like to try to say looking less, sorry about that. We like to say like your natural skin color, whatever skin color you were born with is the color of skin that you should try to keep throughout your midlife.
So it sounds almost like when we tan, it's as if we were scratching ourselves, right? When we scratch ourselves, we get a little redness. And then if we were to burn, then we're bleeding already. So we always think it's attractive to look brown or darker or more tan. But, and that's for the Western world I'm speaking, because I used to live in Hong Kong and it's absolutely the opposite.
Right. You're so much
um,
smarter, right? Yeah.
yeah, so in the end, if we were to look at it as a sign that your body is crying, like you said, or your body is in distress, but we
Mhm.
never look at it that way in this society. We're always thinking we look healthy when we
It's
have a bit of a tan,
right.
and
And
that's yeah.
that goes back to socioeconomic things where working in the fields in Asia was considered low class. And so the luxury class was able to be inside and not be tan at all. And then, and throughout the ages in Europe and America, it was the same way. But then it became like, if you were tan, you had time to be on your yacht or something in the Mediterranean, right? So that Mediterranean tan, that Saint-Tropez tan became very beautiful, especially with like, I think they say Sophia Loren. But now we know that that makes you look a little bit grizzled as you age because your tan is also destroying that wonderful collagen. So I'm a skin cancer surgeon. And when I do Mohs surgery, which is a specific way of removing skin cancers and looking at size histopathology, I can see the shriveled up collagen and elastin. Elastin is another protein that gives your skin that bounce and shine. I can see it. It literally looks like you took a beautiful basket woven kind of fluffy look to like a crumpled bunch of spaghetti that just got thrown down. And so the skin sinks, you start seeing little bumps in the skin, and that's because your skin is now sinking onto the normal glands that are these little columns. And your little lines look deeper because there's just less fluff and less hydration in the skin on the surface and under the skin. So sun damage is it's wounding you, and it's also making you look older.
Mm. But let's talk about the dangers of skin cancers. And you just mentioned you're a skin cancer surgeon, and you're seeing this all the time. And you also had your own experience with skin cancer. And so, really, what are the different types of skincare? Like there's the I don't know if there's dangerous ones and that's going to kill you ASAP, and there's other ones that are maybe slower growing, and we tend to have a little bit less of a concern, as we were say skin cancer versus breast cancer. People would be like, oh, I'd rather have skin cancer, but I don't know if that's necessarily the truth. Like what should we know about skin cancers?
I think with any cancer, it's scary, right? Breast cancer, skin cancer, within skin cancer and also breast cancer, it's very nuanced, right? Some people, it's found early, you can get it, it's good. I think the thing about skin is that you can see it, whereas other cancers or diseases in the body are kind of hidden until it's a little bit more advanced, usually. The wonderful thing about skin cancer is that almost any kind of skin cancer, if you can see something early and catch it before it dives deep into the skin, you can get it and cure it. Basal cell cancer is the number one skin cancer.
Mhm.
1 in 5 Americans will have that cancer, and it is usually a pink pearly bump. I had one under this eye, and then I had a recurrent one multiple times on the side of my nose, where they had to cut all the way down into the cartilage, take my eyelid, and put it on as a graft because of that. And ironically, I'm a skin cancer surgeon, right? So I pointed it out. I had surgery early, but it did recur. So there's a 3 to 5% chance of recurrence, even with the best surgeons and the best methods. So skin cancer can be locally destructive, even basal cell cancer, which is misconstrued as a benign cancer. It's not benign, it's actually a cancer that can spread to your lungs and your bones. And there are people who have died from basal cell cancer, and there are chemotherapies for basal cell cancer. Squamous cell cancer is also a skin cancer that it's more common as you get older. And that is a cancer that starts as a little sandy red spot, usually somewhere on a sun exposed area. Upper lip is very common, lower lip is common, nose, forehead, hands, arms. Women on their legs, they call it tennis lady legs, and they are often scaly red bumps that don't go away. So if you have something that's persistent for more than a month, I would show your dermatologist, not anyone else, but a board certified dermatologist, because it is sometimes a little bit mistaken for something benign. And I've heard that story many, many times from people. One of the more dreaded kinds of skin cancer is called melanoma. And melanoma, one person dies every hour from melanoma. It is the kind of tan brown spot that can look just like a freckle, but it tends to grow radially, so wider, like a little oil slick on your skin. And then it starts to grow vertically down into the skin. And once it starts doing that, it can spread cell by cell. So it's very hard to capture the whole melanoma when you're doing surgery. In the old days, they used to amputate. So if you had a melanoma on your leg, they would just cut off your whole leg. And over the years, they've gotten smaller and smaller with the margins, and now we take 1 to 2 centimeter margins. Just this week, I did a melanoma excision on the arm, and they found another squamous cell cancer on the margin of the melanoma. So wherever you've had sun damage, you can have a whole field effect where you have multiple different kinds of mutations of that DNA that can cause different kinds of cells to go bad. And so this is why I'm saying accumulation of sun damage over time leads to risks of all kinds of skin cancers. Once you've had one kind of skin cancer, your risk for another kind of skin cancer goes up, and some studies say it goes up 25 times, which is scary.
Okay, so you talked about basal cell, squamous cell, and melanoma. These are the three different, the most common, I guess, cancers that are skin cancers that are out there. And the one that is the most common out of this one would be the basal cell.
Yes. Basal cell
Okay.
is the most common. As we age, melanoma and squamous cell cancer become more prominent. And again, that's that memory over time of the sun damage you had as a little kid, and then into your 40s and 50s and 60s. And
Mhm.
so we're seeing melanoma occur in women in their 30s. We're seeing pediatric melanoma. We're seeing people aren't taking sun protection as seriously, or they have a genetic predisposition to it because it can be familial. And so, again, I'm a proponent of sun protection. Again, sun protection clothing and hats and sunglasses and avoidance are the safest ways because you're, like you said, they're chemical free. Sunscreen on your face and on your hands and maybe forearms is a low amount of body surface area. You're very unlikely to absorb those chemicals in a way that's systemically affecting you. When they did some studies, the FDA did an experimental study to request that big companies do their own sunscreen safety testing. They put sunscreen all over people's bodies, 100% of their body surface area, and they did it on replenished the sunscreen for 24 hours, and then they took blood tests and they did find some evidence of the chemicals in their bodies. So that's when they did full body surface area sunscreen for a whole day. What we would recommend, or I'm not speaking on the behalf of the American Academy of Dermatology or anyone, but what I usually tell my patients is, listen, I don't expect you to be perfect. You're human and you're going to forget things, but at least put sun protection in, like have it in your makeup or put it in your moisturizer. At least do your face. And maybe if you're out playing tennis or golf or on a boat, be a lot better about a wide brimmed hat, protect your ears and your whole face and neck, wear clothing that's only giving you an SPF of maybe 15. There's great sun protective clothing that will give you a sun protection factor of 50, and just cover up. That's really the best we can ask for. And then look at your own skin every month, and we can talk about what to look for. But 80% of skin cancers are found by the person themselves. So you have the power to find your own skin cancer and point it out. And if your doctor says, oh, I don't think so, let's just watch it. If you have that sneaky feeling like something's happening here, I don't like this one spot, just get a small biopsy. It doesn't leave you with scars. It's just a little test. And then you have the data point that, it's fine. And then you don't have to worry about it anymore.
Okay, you mentioned that to cover at least cover the face and the hands, and of course in winter including as well. And we're more protected in the winter. But I remember hearing you on another podcast saying that you would tend to see more cancers on men in their back and
Yes.
women more on their legs.
Yes.
So we're probably not protecting our legs enough. And I'm guilty of doing the same. I'm like, I just want to make sure my face and my neck and my decollete are protected. After that, I'm like, I just don't burn so much on my leg,
Yeah.
and I will try to get my vitamin D from that, and that's putting myself at risk.
Yes, thank you for doing your homework. You're awesome. That's great. Yeah, that is the statistic. So women tend to get melanoma on their legs. Melanoma is from chronic sun tanning. And for sure, we've all sat out reading our books with our legs showing, right? We like having tan legs because we look skinnier and more svelte, but it is that chronic UVA sun tanning that has been associated with melanoma on the legs in women. And then for men, as they're out like on the boat or working, doing gardening, whatever, the sun damage on their back has been connected to more melanomas on the back in men. So that again is why I'm saying buy a really great pair of loose pants, and just when you're sitting outside, cover your feet too. But just like a little lightweight, any sun protection is better than none. And if you can spray on the sunscreen when you're outside, spray on sunscreen looks really pretty too. So there's like even sunscreen that's tanning, like it doesn't make you tan, it actually looks tan. So you can get that wonderful feedback that you look tanner, but you're actually using SPF 30 to 50.
What about those white spots on your legs? I remember my mother-in-law, and she was
Mm-hmm.
always in the sun. Her skin was so damaged, but her legs, I would see over the decades that would go first these two light white spots until her whole leg was practically white. It's like white freckles, I guess, the opposite.
Yes.
What's
We
that?
call it benign gut tape hypomelanosis, and that does mean it's benign, usually. Gut tape means like raindrops, so it looks like somebody just got sprinkled with raindrops. And hypomelanosis means white skin or like less melanin. And that is because you have so much sun damage that your poor little those melanocytes that were trying to make the melanin to protect your DNA have burned out, and they can't even protect you anymore. And so it is a sign that A, you've had a ton of sun damage, and B, you are no longer protected by your own natural mechanism, which is that tanning melanin to help protect your DNA. So you are at a higher risk of skin cancer.
Interesting. Okay. Yeah, I was always wondering because I was starting to see those on my own legs. I'm like,
I know. And some people get them on their arms. So the good news is that there are things you can do to repair those cells. So protection should be your number one investment for sure. So protect. I have my mantra for skin protection. It's called the PET mantra. Everyone loves their pet, so you should love yourself. Protect, enhance, and troubleshoot is what PET stands for. You should invest most of your time and money in preventing and protecting these things. So sun protection, UV like clothing, and moisturizing. So those are the protection mechanisms, plus a healthy lifestyle. Literally sleeping helps you because you're repairing and diverting your energies to protecting yourself. Eating well helps you because you're less glycation in the skin, less inflammation in the body. It really does help, again, divert your resources to repairing your skin. Less alcohol, and we can talk about that too. And then using things to help promote your other healthfulness, like vitamin D supplements for women, I think are really important to start. I was very anti all supplements until I hit menopause. When you start checking your labs and if you have low vitamin D, you need to get on that very quickly. Sun exposure is very unlikely to give you the max vitamin D that you need, so I wouldn't go that route. You can get a little sun exposure depending on your skin type and what latitude you live in and how much the UV is actually hitting you. We usually recommend expose a part of your body that's not generally exposed. So like your belly, or for some area of your body that you know that you don't have too much sun damage already. So maybe put protection on your face, but let your belly have no sun protection for like an hour, that type of thing. So vitamin D, I am a pro vitamin D person. Your bone health, this is something that I think is least discussed in menopause, where we know only about 5% of women in the United States are actually taking HRT. When you're in your 40s, that's the silent time when you're starting to deplete some of these important things. So vitamin D in your 40s, bone strength, like supplements that have like osteo-K or magnesium in them during your 40s is very helpful. Actually, being on the birth control pill in your 40s does provide you some sustenance of your estrogen and progesterone. So you could talk to your GYN about that. And even for your skin, those things can sustain you. So you're less likely to get those intermittent outbreaks that people get in their 40s. They get acne, this adult onset acne. To me, is sometimes a little marker that your hormones are starting to change a little earlier than you were aware of. So we usually start talking about those things in the early 40s with our patients in our practice. So it's not just sun protection, which is so important, but it's all those things that can help protect your skin. We've also found that green LED light also helps repair the skin. I'll just do a real quick. The green LED light bypasses your skin barrier, so you don't have any chemicals on your skin. You're not talking about applying something. The green photon wavelength hits the mitochondria in your skin, and it turns on the mechanisms of repair. Red light has been shown to reduce inflammation, and green light has been shown to actually promote more mitochondria in your skin. And as a biohacker, I'm sure you're obsessed with mitochondria. It's such an incredible organelle. But mitochondria is really the energy center of the skin, and it's providing ATP to the natural cells that are there that can then do their work a little bit better. So you're not throwing off the balance of the skin, you're optimizing the balance of your skin. Green LED light has also been shown to hit the retin A receptor. So retinoic acid, everybody's obsessed with for skincare. But often when you put that on your face, it's not absorbing enough to go past the skin barrier into the skin when you have healthy skin like you do and most women do in their 40s and 50s. It's really, retin A was really designed for people with acne whose skin is open because of the pimples, and then the medicine can get inside that. So for women in our 40s, 50s, 60s, and beyond, we can use LED light that can bypass the skin barrier, target receptors in the skin, they're called photoacceptors, and start optimizing some of those repair mechanisms. And then you can use that on the body as well. And lastly, when you're talking about that benign guttate hypomelanosis, or those white little dots that show that your skin has been damaged very badly, you can do fractional lasers. So in the office, the lasers that drill tiny pinholes through the skin shed some of those areas of chronic sun damage and build new skin, fresh, new baby skin that hasn't been sun damaged before, and repopulate some of those melanocytes and those cells that can help protect us better. So I usually recommend somebody like us does that one time a year. I call it the Fraxel shower, because you're not just doing your face, neck, and chest. You also want to do your back, arms, hands, and if possible, your legs. It does get expensive. So again, your best investment is to protect and prevent from the very early age.
Wow, you gave us so many tips here. Okay. The best, every time I interview somebody about a skin and skincare, they always say, just don't damage it in the first place. Try to just prevent. And if you want healthy looking skin and skin that is actually healthy, then yeah, protecting but then we get offset by, oh, we should be in the sun and spending time outdoors. And like you said, it's just a balance. And so you also mentioned the laser, actually, that was quite interesting in terms of that you said Fraxel laser. It's a different one type of laser, because again, we could do a whole podcast just on lasers, right?
Yes. Uh-huh.
But Fraxel laser is particularly good for clean look. If you can do the whole body, you said it was expensive, and then
Yeah.
that rejuvenates the skin, and so it's able to like have a second life, is what it sounded like, right?
That's a nice way of putting it. Yeah. So fractional laser is a category of lasers. So laser resurfacing means using lasers to get better skin. And then there's like ablative laser, which can wipe out your whole skin. It's not used that much anymore because it was when it was called CO2 laser resurfacing and it would like melt off somebody's face, but you couldn't use it on the neck, chest, and other areas because you would scar so badly. And it also could make people look kind of plasticky and weird. So that's not being used as much anymore. There's a laser called erbium YAG laser that's used. And then the best genius in the field of lasers invented this concept of not fully ablative, but that fractional kind of pinhole pattern through the skin. So you're leaving some skin behind to repair faster. And then it's less downtime, it's less painful, fewer side effects, and it gives you about 22 to 25% of new skin surface every time you do it.
So is this Fraxel laser or fractional laser, and you giving it a second life, is it actually protecting our skin from skin cancers as well?
So it has been associated with a reduction of precancers, and those precancers can then go become skin cancers. So we don't use it once you have a skin cancer. It's not really gold standard to use a laser to treat a skin cancer because then you're just like, it's like playing roulette with the skin cancer. But the precancers, we usually have about 2 years before a precancer can accelerate into a skin cancer when we're talking about non-melanoma skin cancer. So these red little scaly patches. So we can do fractional laser. There's something called photodynamic therapy that is FDA cleared and used all around the world, where we put a medicine on the skin and we use a blue LED light or a red LED light to activate that medicine and blow up the little skin cancers. So that's photodynamic therapy. And the field is called photobiomodulation. So using photons to biologically change or treat something is called photobiomodulation. And I love that. It's so inspiring. And it's been used for over 25 years for skin cancers and for acne. Light therapy has been used for psoriasis, eczema, many things. We can harness that power of the biology of the skin so easily because it's right there. And the skin is a visible, like it has visible light receptors like our eyes do. Our eyes are taking visible light and converting that to information to tell the brain something and release hormones. The skin also has photoacceptors for that visible light spectrum. And red light, blue light, purple light, amber light, and green light are used by those photoacceptors in the skin. Also, you get that psychological benefit. The mind body skin axis is a real thing because of that unique feature of the skin to respond to visible light. So photodynamic therapy can get you back healthier skin. Fractional photodynamic therapy is something I published on a long time ago, where we do fractional laser first, put on the medicine so it can saturate into the skin even deeper now that we've lasered it, marinate in the skin for about 30 minutes where that medicine can get into those precancers, and then put them under this big blue light to blow up those cancers. So fractional photodynamic therapy is something that has been published, is used widely, that we first published on in about 2005.
And that's more of a prevention, or is that a treatment?
It's both, because
Oh,
you're treating the bad skin cells and you're doing the whole area. So remember we talked about that field effect when you get sun in a whole area. You don't even know how many skin cancers you're building in that area. So if you see one, you should think I probably have more than one sun damage area. So while the treatment is really trying to treat that one noticeable one, you're also probably killing microscopic precancers and skin cancers as well by treating the whole area.
what is the standard of care in terms of treating a melanoma? Let's go with the melanoma, because I imagine the basal and the
100%.
squamous is
Yeah,
different
so
treatments, no?
100% surgery. Like you don't
Mhm.
mess with it. There are some other things called confocal microscopy, like non-surgical methods for treating melanomas, but they, in my opinion, are not ready for prime time. Sometimes as a physician, that do no harm oath we take is also thinking about, would you do it for yourself? If I had a melanoma, I would not do anything but surgery, and I would do it fast and I would do it completely, and I would not worry about the scar because you just want to get that off your body. The great news about melanoma, and this is not meant to liberate people to get more sun damage, but it's meant to give solace, I guess, to maybe some people listening who do have melanoma, is that there are wonderful new immunomodulator therapies that can be taken by infusion that can be very helpful for melanoma. So if you had surgery, but it had already spread to the lymph nodes, just like breast cancer has new wonderful treatments, melanoma has had a renaissance in treatments. And so the mortality rate is a lot lower now. So that's great.
You also mentioned in a episode I was listening to about your technique. I want to call it like orange peel. I don't know what it was. I don't remember what it was called, but you
Yeah.
had a special technique that I think not many doctors are trained in. That's different in terms of removing surgical removal of a melanoma.
Right. So it's not melanoma for that. It's technically non-melanoma skin cancer. So basal cell cancer and squamous cell cancer are good because when you have one, it stays like, I'm going to use this as a little model, but like you have a cancer and it's intact, right? So as the cancer spreads, it's all connected to the same body of the skin cancer. Other types of cancers like melanoma and breast cancer, they spread cell by cell. And so you can't really find all of it easily. Mohs surgery is named after Dr. Mohs, M-O-H-S. That's the surgery you're talking about. I did a fellowship in this surgery, which is a way of removing skin cancers. So you are the surgeon and the pathologist at the same time. So we numb the spot, we remove the little skin cancer, we take the tissue into our own office that has a lab, and we have a technician who is trained to process that tissue in a very special way where we're peeling the orange, so the outer circumference of that tissue that we took off, and we're using color coordinated ink on the edges so that I have illustrated a drawing of the cancer based on, let's say I take it off right here. I'll draw an oval on a piece of paper. We'll mark the different orientation plus ink it. So it's like blue, green, yellow on certain edges. Then she cuts 4 micron little pieces of that frozen tissue and stains it and puts it on a slide. So then I take slides as a pathologist, slip it under a microscope, look in at 100 times magnification, and then I can see, like I mentioned, that sun damage. I can see the orientation of where we inked it, so I know how to come back and correlate it to the person's actual skin. But then I can see where the squamous cell cancer might still be, or the basal cell cancer might still be. And that's basically a photographic knowledge of what those cancers look like. So recently when I'll do like 10 of those cases in a day, I'll have all different kinds of body parts that I'm taking off little excisions from. Recently we had one right here on the little nose, but it went deep underneath and up the whole nostril and beyond, and we were able to get it all out. You'd be surprised how deep you can go in this area, and there's still more tissue beyond. But typically skin cancers do not, that when we're lucky and we get them early enough, they're still within the top surface of the skin and the top of the fat, but they tend not to go all the way down into the muscle. Sometimes on the scalp, they will go all the way into the bone, and then I have to refer the patient out away from my lab because I don't have the ability to carve bone and check it under the pathology. So I know that sounds really gruesome, but I think it's important for people to know that I'm just one surgeon and I'm very busy doing skin cancer surgeries on a population of people who know about skin cancers and know about sun protection, and it's still very common. So if there's one message about this day, and I'm so happy you're doing a podcast on it, is that skin cancer is still the #1 cancer worldwide. If you even add up all breast cancer, all lung cancer, prostate cancer, add them all together, skin cancer is still more common. The incidence of skin cancer is still greater than all of those combined. We like to say it's largely a preventable cancer, and it kind of is. Like if you wear your sun protection, you have sun avoidance or sun smart behaviors, like don't go to the beach at 10 o'clock in the morning until 2 o'clock because that's most convenient for you. It's also the worst time for you to get sun damage. And wear your cute hats and things like that. So like the listeners to your demographic, like buy the good hats and buy the good sun protection, just do it. And it'll really help us like not have to do skin cancer surgery on you. I want to put myself out of a job, essentially.
So you mentioned wearing big glasses and protecting your eyes. Like, and I heard you talking about you can have cancers in your eyeballs, right? And
Yeah.
I'm not sure how you remove that, but that's why you're promoting let's protect the eyes with glasses. And in this biohacking community, we're all about Don't wear the glasses because you can't set your circadian clocks. You want to have the
Oh,
sunlight in your eyeballs in the morning, in as first thing in the morning when you wake up, go out, get sunlight. And then obviously if you're wearing, I mean, you're out all day, you wear your sunglasses, but it's more about setting the circadian clocks in the body. So how would you recommend somebody navigate that? Because we do want to be able to sleep well at night and get our melatonin production at the right time and
I
not wait too late.
I I think, with all due respect, that I think that a little bit of knowledge can also go the wrong way, right? So a little bit of understanding about circadian clocks and circadian rhythm, and then taking that logic a little bit down the wrong path can lead to conclusions that I think are just like not so wonderful because you have to trust your body. Like our bodies evolved over time into the most complex, so smart, sophisticated organisms. Like we are so smart. You can never understand how smart your own body is. The biology of our body is so much smarter than any of us will ever be. ChatGPT will never be as smart as however we evolved. And so when you're saying, if I wear sunglasses, my body won't know that it's daytime, is just not logical. Also, like I just told you, your skin cells are also visible light receptor organisms and are telling your brain, like, this light just hit me. My sympathetic nervous system now is totally on. My parasympathetic nervous system is now going down. The skin has those neurons as well and will tell your brain what it needs to know. So sunglasses are not going to have the power to offset your own body's knowledge of the circadian rhythm. If you were in a cave and you had no sun for 3 days, no ability to see any different light gradations, that's true. You would have sundowning, it's called. But your body knows if you go out in the sun and wear sunglasses, your body still knows that it's daytime.
I heard about a study where they, I don't know, blindfolded people and they did find out, yeah, this is how they sort of found out our skin has light receptors. You could still manage to, I guess, yeah, send the signals to the body that it is day and light based on, I think it was a sleep study. I think it was people who had trouble falling asleep because the lights were on, but they blindfolded them and their skin still picked up that they shouldn't be sleeping because there's quote unquote daylight.
The daylight, yeah. I mean, it's so smart. So, like, back to my obsession with LED light, the worldwide #1 use of LED light is the amber light for seasonal affective disorder. And that is using light to like boost your skin cells and your brain cells to know that, okay, these are endorphins now. You know, your endorphins are telling you that you're awake. And that again is just that whole sympathetic nervous system turning on and resetting that circadian clock.
So then I'm wondering, we talk a lot about photobiomodulation in this podcast. We interview people who understand red light therapy, and they would recommend going outdoors in the morning, the very early hours, I don't know, up until maybe 10 or 9 o'clock. But when let's say a sunrise and a sunset, when we have that sky is all red and you could see your skin is a bit of an orange glow or that amber light maybe that you're talking about. And they say this is really healthy, really good for you. And it's also evidently your eyeballs as well are taking in this red light. It's the waves, and that could be healing. And if we can't do that, you go buy a red light therapy device. But how true is that? And sort of if we go outside for a sunrise and sunset, should we still keep our glasses on?
I think you should keep your glasses on. Okay, so amber light is this orangey looking color. That's morning. Amber light mimics sunlight. It gets that sun and sympathetic nervous system going. Green light also gets your sympathetic nervous system going. And this is where you get that photobiomodulation effect. Purple light is a combo of blue and red. So you're getting a mixed message because blue light is also wakes you up. Red light, the way it works is it hits your dopamine. It gets your brain to release dopamine. Dopamine is that quieting, happy hormone, right? So that's where your evening sunset is. It's the red light concept where it's hitting dopamine that's getting your parasympathetic nervous system to go on superpower. Pulsed red light has actually been shown in Nobel Prize studies to actually have a little bit of a better effect on that mitochondria. So the electron transport chain, which is like a little roller coaster, needs time And so the pulsed red light has been shown to actually pump out even more efficient ATP than the high dose continuous wave red light. And then blue light, like I said, is also that morning light that gets you going. It's also been used in patients who have dementia, because blue light also helps memory. So all these lights are being used in many fields of medicine right now. And transcranial red light has been shown to help reduce the formaldehyde effect that is implicated in Alzheimer's disease. So it kind of like cleans up some of that. And blue light has been shown to improve memory in patients with dementia. And it's also been used for kids in college who are studying, people who, and then blue light is the one that's used for the precancers on the skin and also used for acne because it kills the bacteria. So all these different lights have many different ways of affecting the skin and the brain based on that, like I said, the brain, which releases some of the hormones. So your red light is releasing dopamine, which relaxes you, puts you in that parasympathetic state and allows you to sleep better. It helps reduce anxiety, which is amazing. Teaches you how to breathe a little bit better, which has a lot of evidence-based medicine. Blue light, green light, amber light are all the go, go, go. And that's the daytime treatment that you would get to help your circadian rhythm in that way.
The device, the circle device that you showed me, and you said blue light and it turned blue. But we also think about blue light as coming from our computers and our phones and even the sun, and it's not blue. So is that device just creating, it's just blue bulb, but it's not, but it has the wavelengths of a blue light. It's just showing you.
Yeah, so when you really do a deep dive into blue light and from your devices, you're also mixing it. It's many hours, right? So it's the time duration of the amount of light that you're getting. It's a mixture of high intensity blue because your screen has to shoot out a ton of intensity. It's also mixed with the infrared light that's in your screens. And so when you look at really, does blue light from your screens affect your skin at least and increase hyperpigmentation? There's a lot of evidence that it does not. So that means it's not really affecting your skin as much as the other wavelengths. So infrared light from your screens is implicated as potentially harming your skin and turning on that melanogenesis that we talked about before. So when you're using LED lights, you need to have, these are high quality, different LED lights from different, not specific wavelengths, but bracketed wavelengths. And the blue light is only used for 20 minutes. So there are dosages that have been worked out where it's like FDA cleared to use blue light for 20 minutes for the acne, for 20 minutes for the precancer. So those are the protocols for photodynamic therapy. And so for us, when we invented the Sphere disc, this has actually been called the #1 dermatologist invented light, and also #1 hands-free light. So you don't have to wear it, which many of those have been recalled because of the glare to the eyes. So you don't want to have the blue light or the red light that close to your eyes because that wavelength intensity is very intense. Even if it's only for 3 minutes, there have been, like Neutrogena recalled all of their wearable LED masks because of permanent damage to the eyes. And so that's published studies. You can see that the FDA recall on that. So having a panel light is often a little bit better. With this panel light, there's also a filter over it, so you're not getting glare, that high intensity glare. And it's used for 20 minutes and it's about 12 inches away from your body. So you're getting face, neck, and chest all at the same time.
Okay, so wait, we almost have to do a whole other podcast on this little device that you're sharing. It almost looks like I have the same with my.
I know, exactly. And it also does hold your cell phone, just like that one holds it. It holds it right here. So you can waste 20 minutes. The thing that you need to do when you're using LED light is you need to be compliant, right? Because it's a low level light therapy, it's like homeopathy. You need to do something a little bit, but many times rather than a laser that comes in and just like hits your skin once a year. And the way to make yourself use it is to make it user friendly so that you can be compliant. So this one sits in front of your computer. I'm tapping on my keyboard. I'm talking to you. I'm also getting a full treatment. And 3 times a week for 6 weeks was shown to reduce skin age qualities by 4 years. So that we use this Canfield Visio system to grade the skin on sun damage, sunspots, pores, fine lines, wrinkles, redness, all things that are associated with aging skin. And just by using the green light for 3 times a week for 20 minutes for 6 weeks, the true skin age went down by 4 years. So that's really great, showing that it can help regenerate some of those qualities of the skin. And then mimicking photobiomodulation and photodynamic therapy from the skin cancer work I told you about, we actually made a serum that has photodynamic ingredients in it, and that'll help your skin target some of the things that you personally might have. So photodynamic beauty is really just a copycat from photodynamic therapy in the office.
Okay, I want to do a whole other episode on this. This is really intriguing, and
Yeah.
I'm getting totally distracted. I want to send me this device, send me that lotion, and then like we have to do a whole episode on just on skin and beautiful
Yeah.
skin. But I want to go back to the cancer. It's
Skin
like,
cancer.
sorry, skin cancer.
Yeah.
And gosh, yeah, that was just so interesting. It just, and people who are listening now, it looks just like one of those circle lamps that we
Yeah.
influencers use. But we'll like talk about that. And what's the name of that? Just
The MM sphere, and
MM sphere.
it's called Marmur Metamorphosis. So I'm Marmur. Using my doctor knowledge to transform how you think about your skin and transform how you understand photobiomodulation from a dermatology perspective. And I love that biohackers are all over photobiomodulation. It's such a brilliant concept. And why it is so smart with your skin is that we know we have lymphatics, we know we have circulation, but there's an organ of the body that no one knows about called the interstitial fluid. Interstitial fluid is that fluid that's circulating throughout your body, and it's full of cytokines, inflammatory markers, really interesting markers that communicate from one organ to the next in light speed. So I call it like the internet of the skin. So you know how you can text me a photo of you, you're in Spain, I'm in New York, you can text this data across the world in a nanosecond. The skin is the same way. So you're able to, let's say you have a mosquito bite, right? And you feel pain. So that bite is hitting something that's causing this transmission of information and then a rush of inflammatory cells right to that area. But no one knew how that happened until recently, where they were able to capture, they actually found it from the GI tract. They were able to see people who had inflammatory bowel disease. They never knew how that was happening. And then they were able to fix the tissue when they did biopsies and find this whole other system called the immunoinflammatory system, the interstitial fluid. And that's where inflammation resides. Photobiomodulation is targeting that interstitial fluid and changing the balance of the tissue that it's been treating. So we can talk all about that,
I
but that
know.
is a whole field of medicine. Yeah.
Yeah. Oh my God. I'm so distracted. I love it. I'll have a link to it in the show notes. Do you, what is the price more or less? What are we talking
Okay.
about?
So these are
Quickly, because I want to go to the skin cancer again.
quickly, little guy, travel, treats your whole face and neck, $3.95, lasts for years and years and years, use it 3 times a week. Big guy, the MM Sphere Lux, even better, $7.95, same thing, 3 times a week, just gets a larger surface area, better treatment. Some of the other competitive devices are like $2,000, and they're just a small device that you have to sit and put on your face for 25 minutes a day, every day, which no one's ever going to do.
Okay. So I'll have a link. I'm going to put you on the spot. We have a link, I mean, a discount code or
Yes,
something.
you're getting a discount code. Thank you so much. And you can put that in there too.
Great. Okay. So we'll have a discount code and then hopefully you'll make it Zora, Zora, because we always try to do that.
You got it.
And then
Yeah.
I want to go back to the skin cancer because there was one question I have. I heard on another podcast where it was a device called the Mitolux and it uses UVA, UVB, but it's the information I took away from that I thought was super interesting was that if you go out into the sun in the early hours, when it's that red light or like sunrise, sunset, and he's talking about like 10 minutes, then your skin is protected later on from some of the sun damage that can happen later on in the day. Kind of like a sunscreen.
I think the only way that that could be true is because you've already told your body you're going to be injured, and those melanocytes might be activated to start making some of that pigment to help protect the DNA. I think what you need to do is try to compare it to something that's understandable. Maybe you're getting an SPF of 2, but you're not really getting an SPF. That means you can stay out in the sun for 20 minutes, not 10 minutes before getting a sunburn. So it's really not conferring like that much improvement. What's nice about it is that you're being mindful of sun protection. So if you actually are getting up early and going out, you're thinking along the right lines, like I want to protect my skin. So I guess you should just take it one step further and wear some clothing and put on some SPF 30. But I'll tell you, my dad, who's a professor who has a daughter who's a dermatologist, doesn't even know what SPF stands for. So it's not like a broken record. Like we do need to keep talking about sun protection factor and what are the best ways to do it and debunking some of the myths that it's toxic, just like saying it's really safe for most people. We really have not found any tumors or any illnesses associated with sun protection. So I would just remind people that the amount that you're using on the surface area of your face and neck and maybe hands and arms is really not that much. This does bring up one thing, like how do things get into the skin and why is the skin something that's a barrier? Just remember your skin is made in a way that you've got a dead surface cell, like your roof of your house is basically just like hardcore but thin. The stratum corneum on the top of your skin does not allow things to penetrate. It prevents bacteria and viruses and your microbiome from seeping right in. It is also protecting, like you take a bath, you're not absorbing that water, right? You're not turning it into like a bloatfish. So your skin is really mainly a barrier that does not penetrate easily. The way to get things to penetrate the skin is better are to use like stickers that will help press ingredients on for a very long time, and maybe they can percolate in. The gels that people use, like the estrogen gels, are made with alcohol, and that can disrupt the skin barrier a little bit where you put it. And so temporarily it can absorb things a little bit. But so when you're using patches, which are high concentration, and a sticker, you can pass that barrier. But in general, putting on a thin film of sun protection is not going to disrupt the skin barrier. It's mainly mineral, which is going to stay on top of the skin and reflect back the rays that are hitting you. So you're really not having a chemical reaction. You're not absorbing that. It's minerals like zinc and titanium that are healthy for your skin and are going to ricochet off those photons away from your skin.
But what if you're out in the sun all summer long and you're dousing your body with this for 3 months, or you live in a country where you can wear shorts all the time, so you want to protect your legs? And I'm wondering if there's some skincare sunscreens that are more toxic than others, or you say it's not, but some people would probably
Yeah.
argue it. But because if we're going to go there, let's try to get a better product.
Yeah. So the ones that are mineral are considered non-absorbed because they're larger molecules that rest on top of the skin. The FDA study that suggested that things are being absorbed were the chemical sunscreens. And so if you're really concerned about it, just get 100% mineral sun protection. That doesn't look as good. That's the not like I would say vanity issue is that they tend to look a little bit chalky or tacky. So do your best or get one that's like 90% mineral, 10% of the chemical sunscreens, because then also your concentration is a lot less and you're more likely to reapply it. But that's where I said just buy some really great flowy pants or something like that too, because then you're not really worried about it as much.
How much do you trust the Yucca apps and the EWG website,
That
Skin
is a
Deep?
great question. I am a little skeptical about those apps. At least in the old days, we would nickname it environmental worry group more than environmental working group, because if you looked at the people who were the experts, none of them were really photobiology, dermatology chemists, but yet they were commenting on the safety of products for the skin. So they could be better now. I'm just a little worried. There is a gap of knowledge about how topical things work on the skin. And that gap of knowledge is intentional, because if studies were required by companies to show how certain ingredients affect the body, they would have to show that it changes the structure or function of tissue in the skin. And then it would become a drug. And then it would be required by the FDA to have very expensive research studies. So it's intentional that they bypass this whole thing about how do things actually work on the skin. And then that's where these apps come into play, that they're trying their best to help guide us, but they also don't have really good studies, well-structured studies that are blinded studies, meaning like the person analyzing the study doesn't know who's doing what. There's not, it's just like the scientific integrity behind some of that knowledge is not that sound. So I think what I would say to most people is use your common sense. At some point, we're going to have to just trust that our bodies are working for us and that we're not putting toxic things on our body, and that the companies who are making that don't want us to be in danger.
What sunscreen do you use?
Oh, that's a good question. So we make a sunscreen that is mainly mineral. And we'll give you a link to that too. I like a blend of the mineral plus the chemical sunscreens. And I like to use things that like Elta MD, I think is a nice brand that is mainly mineral, doesn't sting. If something stings, then it's not right for you. There are some ingredients in Europe that people tend to like a little bit better, but some sunscreens are more compatible with different people than others. People's sweat can change the color of sunscreens. So some people, they'll put on a particular sunscreen and their sweat will turn the sunscreen yellow, and then you'll never use it. So just experiment with brands that you trust and reapply, especially on areas that you know you're prone to getting sunburns and deep tans.
And is it better to have the PA the four pluses on it?
Yes.
Okay, good. Well, okay, we're going to do a whole episode just on sunscreen, I think. It's because I have to let you go. I know you have a meeting, but just to wrap up, skin cancer is a real thing. We need to protect ourselves. Don't just willy-nilly go without your sunscreen, or best things probably protect it with clothing, hats, non-chemical things. If you are going to use sunscreens, then you use the mineral-based if you are more concerned, or the very little percentage of chemical. Yeah, don't be fooled that glasses are bad for you. It protects your eyeballs from skin cancer, and you will still understand, your body will still understand that it's time to create melatonin in the evening, and the skin has light receptors. And that's kind of in a nutshell what we talked about. And then get checked, right? Get checked and screened for any moles and spots, and check all your skin every year, probably, right?
Yes,
Okay.
exactly.
Oh my
Yeah.
gosh. All right. Well, thank you so much. I'm gonna have to book you in for another episode talking more about skin. I love what you have to say, and just bringing the awareness to skin cancer. It is a thing, and it's so easy to forget in this community when we know that sun is good for you. Sun is wonderful. The wavelengths and the light, photobiomodulation, all this is really cool stuff. So I don't want people to be scared and indoors and never go out either, right?
Yeah. That's why live your life to the fullest. Just be a little bit smarter and invest in the protection.
Excellent. So I'll have links in the show notes to that amazing sphere thing and your website and the promo codes. And I will have your TikTok and your Instagram and all those things in the show notes so people can follow you even more. And as you are also, I guess, in menopause, which I didn't even think about it considering your skin looks like you're 25. Well, do you have any last words for a woman going through the menopause transition?
Yeah, I think start early. Like start thinking about it when you're 39, 40, 41. Prepare yourself, like I mentioned, with good lifestyle, reduce your alcohol, start thinking about your vitamin D, really take care of your bones and your skin with your sun protection. Start talking to your dermatologist. I have patients in their early 40s who are like, okay, Marmur, I need the checklist. Tell me what to do. And I'm like, okay, boom, 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 boom. It's holistic. It's not just your skin. Your skin is an organ that helps the rest of your body. Your skin helps your bones, your skin helps your brain, your skin helps your breasts. Like the skin is a biological organ that is sort of like the most outside organ that's telling the inside what to do. So talk to all of your doctors early about how to start taking care of yourself. And if they can't have that conversation, maybe you need to have a different doctor who's better informed and more aligned with you as a woman who's in early, like pre-perimenopause. That's the time to start thinking about these things. When you're already in menopause, I'm a big fan of talking to your doctor about HRT. I do think reducing alcohol, helping your vitamin D, helping your bones is so important. And then with your skin, using the green LED light with great sun protection and great active ingredients that aren't too much for your skin, learning how to bypass some of the marketing data and getting once a year skin tightening, which we didn't even talk about, and once a year fractional laser shower is the way to go.
Wonderful. Well, thank you so much. And thank you everyone who's reached the end of this episode. And I hope you have a good day, good night, good morning, wherever you are. And Ellen, have a wonderful day in New York City.
You too, Zora. Thank you. It's so fun.
Bye
Talk to you
bye.
soon.